for taking a look at this video. I'm a chiropractor. We're located here in Honolulu, and I'm actually going to show you a couple of things that you can actually expect on your first visit visiting our office. First thing we would do is we'd have you fill out some paperwork, the basic personal information, your current health condition, what your major complaint or reason for coming to our office. We take a look at your current health condition, what's actually taken place there, any kind of past health history that also gives us some information. For example, if you've broken a bone, how the way you actually had that injury, whether it was from sports or an auto accident or things like that. So once we do that and we actually understand your health goals, that'll allow us to better focus on what your needs are and get you better as fast as possible. So what we're going to do right now is show you the office real quick and what you can expect.
Cool.
Alright, so I'm going to take you back here to our exam room. So first thing we do is we take a look at, we open up a new patient file, what their member health record looks like. I fill in their information, the date, and then I drop in a picture. And this is actually what a file would look like. So once we did that, again putting it back here to the normal cervical spine, then we took a look at took a picture of his neck, and this is actually what we found. Again, this green line here, if we just took that out of the way, that represents the normal. But if we just compare these two pictures, you can see that his neck, even though it had a slight curve, which was a lot better than most of the patients that I look at, he still was lacking quite a bit of that healthy curve that he needed within his neck. So the next thing I want to show you here again is the x-ray machine and how this is actually going to enable me to see the information that I need when it comes to your spine. Okay, another thing that I would do right before I would take the x-rays of your spine is that I would take a look at your posture. I would do a simple range of motion check, where I check out your range of motion from left to right and do an extension and a flexion. And if it was low back, the same thing. And then also, when it comes to your posture, I'm able to put you up against a grid like this, and because of the grid, we can actually see even easier if you have one shoulder higher than the other, or one hip higher than the other, and those things all give us information as to what's happening with your spine. So here's our x-ray machine. It's going to tell me exactly what your primary misalignment or subluxation is within your spine. Okay, so we just took a look at the exam room, what the procedures are there and what we're going to be doing for you on your first visit. Now we're going to take a look at the treatment room and what you can expect after that. Okay. Once I take a look at the x-rays, again, that I would have just within a few seconds of taking them from your spine, then I'm going to take you upstairs. Okay, so here we are in our, about to walk into our treatment room, and this is actually where I treat my patients and where people get well. When you first take a look at the table here, you might notice that it's in sections, and the reason why is because these sections actually lift and have a slight drop to them. And when they drop, again, that helps me, it actually helps to facilitate the adjustment for the patients while I provide that adjustment. So we have, again, a computer where we can, if I have someone on the table, as they continue to come back for visits and we're continuing to make improvements within their spine, if they have a question or I have a question within my mind, I can just pull up their records from downstairs and take a look at them up here. The reason why I do have an open treatment area is because whatever I say to the patient, everybody hears. It's a tremendous value for me, the patient I'm treating, and for the people who are waiting. Because if someone's laying down on the table and says, "Oh doc, what is that neck exercise you told me about?" And I'm like, "Which one?" And then we start talking and engaging in conversation about the cervical spine, how you can keep it in better alignment, what you need to do for your posture, a scapular squeeze, a chin tuck, all this kind of stuff. And people over there waiting are like, "Oh yeah, I forgot about that." It's valuable, so I don't have to repeat myself, or I can do it less throughout the day because other people are there witnessing that kind of stuff. It's very good. I'm going to show you actually our exercise area. So I've created this area here, this little rehab section in my practice. I have exercise balls here that they can use. Again, the mat is big enough where I can be on the mat as well as them, and I can teach them different exercises, stretch out their hips, their lower back, their hamstrings, quadriceps, and back muscles, and arm muscles, so forth. This is a back stretching machine. So thank you again for watching this video and seeing what you can expect on your first visit to our office. Again, my name is Dr. Steve Rawson. And we look forward to your next visit, because on your next visit we're actually going to give you a very detailed report on what we found, why, and what we can do to help maximize your health for the best.